So thank you all for joining us today. I'm David Blackstein. I am with Bard College. I'm the co-director of the Worldwide Climate and Justice Education Week. We are delighted to have our colleagues here from the American Public Health Association and with each of you who are joining us. We're going to be learning today about the connections between climate change and health. We're going to be learning about resources that you can use in your roles as health professionals or educators to educate people about these connections. And the reason, and this is part of a partnership between Bard College and our project and the American Public Health Association to raise people's awareness about that connection. We are doing this in the context of Worldwide Climate and Justice Education Week that will take place the first week of April 2024. And I know that we're getting a lot of people joining us now, so we thank you for joining us. I know many of you are not familiar with Worldwide Climate and Justice Education Week, so we're going to begin by showing a 3-minute video to introduce you to Worldwide Climate and Justice Education Week, and then we will turn to our friends from the American Public Health Association who will talk about the connections between climate change and health and how you can participate in Worldwide Climate and Justice Education Week and share your knowledge and others' knowledge with the about the connections between climate and public health. So, Kirian, do you want to introduce the video first? And actually, let me just introduce my colleague, co-director, Eben Goodstein from Bard College. Looks like you're in transit, Eben. Do you want to just say a quick hello to everybody?
Sure. Welcome and excited to have the conversation today. We're excited about the progress of the Worldwide Climate and Justice Education Week. Hoping that everybody's signed up, and if you haven't, you'll do that today. So with that, let me turn it back over to you, David.
Great. All right. So, Kirian, why don't you roll we don't say videotape anymore, but roll the presentation, please.
Where are you emotionally on climate change? 1 is I never think about. 10 is paralyzing anxiety. Can't sleep at night. Don't want to have kids because their world will be through this topic.
The Worldwide Climate and Justice Education Week is about helping people move from climate despair and disengagement to a mindset of climate repair. This is the education that changes the future. So Climate Week is for everyone. It's for students, faculty, and staff from all subjects, like artists and psychologists, scientists and business majors, students of music, literature, economics, international affairs, healthcare and engineering, you name it.
Join tens of thousands of people around the world in growing climate education. The first week of April, 2024. You're not alone. People on your campus are really worried about climate change. If you step up, others will join you. At your school, you can make climate an event. This means solutions and justice events on your campus. Art, theater, panel discussions, films, faith meetings, music, games, fairs, and displays. Check out our website for examples from all over the world. Engage your whole school.
On top of your events, you can also help to make climate a class. This means encouraging climate-concerned teachers from all subjects: art, history, chemistry, psychology, all subjects, to spend at least half an hour talking about how climate change solutions and justice are relevant to their field of study, how artists, historians, chemists, and mathematicians are all thinking about climate change. We have step-by-step guides on our website to help you make this happen.
Last summer was the hottest in history. Massive fires, heat waves, floods everywhere. We have to stop it from getting hotter every year. You can help organize Climate and Justice Education Week at your school. The biggest threat to our future? Thinking that someone else will lead, that someone else will stop the climate crisis. Now, not next month, not next year. We all need to step up. Join us.
Thank you. Thank you very much. So, and the last speaker in the video was Carrie Ann Canfield, our communication director, who is managing this website. So, thank you. And as Carrie Ann said, you know, we all need to step up, and the fact that you're here today to learn more and to share more is evidence that you are providing that leadership that we all need. So we will talk more towards the end about how you can participate in Worldwide Climate and Justice Education Week. It's open to everybody, whether you're a teacher at pre-college, college, if you're a public health official, if you're involved in government or non-government or faith organizations, that there are roles for each of you. And I think the important thing about it is that we're not dictating anything. We're inviting. We have created an opportunity this first week of April for people to do what they could do any day, which is to be educating others, and in fact, which most of us do every day, educating others about our health and about the connections between climate and health. But we're doing it in a more formalized way, which empowers people, provides them opportunities to get more assistance from us, to have branding materials, to have certificates of completion, etc. Over the past couple years, we've had more than 600 total events in more than 60 countries around the world, collectively reaching probably nearly 100,000 individuals. And with your involvement this year, we're going to reach even more and do even more. So one of the ways that we are successful is by having fabulous partners. And so we're so delighted to have the American Public Health Association as our partner on this. Our principal, our partner from the health field. And we're going to have three fabulous presenters today. So first, I'm going to turn to my friend Layla McCurdy. Layla is the founding chair of the Children and Environmental Health Network, the committee of the American Public Health Association. Layla and I have been collaborating for more than 2 decades in raising people's awareness about the connections between health and the environment. So I'll turn it over to you, Layla, and then you can introduce the others.
Thank you so much, David. Yeah, this is just a wonderful opportunity to expand this partnership and really focus on our common passion and work. And I'm delighted to be here. And on behalf of the American Public Health Association, it is my great pleasure to welcome you from around the world to this webinar. As David mentioned, I am the founder and the chair of the American Public Health Association's Children's Environmental Health Committee. I'm actually going to introduce our climate and health education toolkit, which I believe, just having rewatched this wonderful video, it is the perfect tool for Climate and Justice Education Week. So to get us started, I will give a brief overview of the Climate and Health Youth Education. Is there a background noise? Okay, so I will give a brief overview of the Climate and Health Education Toolkit, which was developed by the Children's Environmental Health Committee in collaboration with APHA Center for Climate Health and Equity. And we have colleagues from that center. Michelle Loosely will be speaking next. And we are really delighted to have this collaboration to offer this very, very useful kit. So as we all know, climate change is an imminent threat to human health. Children, especially children of color and children from low-income communities, are more vulnerable to the physical and mental health impacts of climate change. And our children are mostly aware of this threat and need our support to help them deal with it, both physically and mentally. One of the ways we can support our children is by providing them with the knowledge, tools, and skills which can empower them to take action for climate solutions. Unfortunately, most schools do not offer education about climate and health. So to fill this gap at the APHA, we wanted to mobilize the public health professionals. And we created this toolkit to provide the information and tools they need to educate the youth. Now, at the heart of the toolkit is the Climate and Health Lesson Plan for grades 9 through 12. This lesson plan is based on the National Institute of Environmental Health Sciences curriculum. That curriculum meets the United States National Common Core standards and is aimed directly at teachers. APHA's lesson plan adapts those materials, staying true to the evidence, to make it easier for public health professionals to present the lesson plan in their local high schools as guest lecturers. In addition, we added a couple extension activities, one of which is on environmental justice, as well as some supplemental tools and resources to create this toolkit. The lesson plan takes 100 minutes to deliver, so usually it's 2 class periods or whatever works for the setting. The toolkit is posted on APHA's website and on the Children's Environmental Health Committee's website. And I believe Michelle already put the APHA website there, and I will add the Children's Environmental Health Committee website to the chat. And we have a lot of supplemental resources on the website, along with the toolkit itself. Thanks so much for participating in this webinar. And as a result of this, we hope to inspire you to join this effort to educate and empower our youth. Please take a look at the materials and get involved in your community to help educate and inspire children. You can contact your schools and volunteers to teach this. We have an email template you can use just to make it easy for you, or you can engage others in your community to teach it using a recruitment flyer that is on the website. So please keep in mind, this lesson plan can be adapted to other grades, even higher education classes, and we have some examples of that. It can also be adapted to other settings, such as after-school activities or summer camps, and we have successful examples of that as well. And please let us know about your activities by filling out the survey on the website. If you're interested in getting involved, please feel free to reach out to me. I will put my email in the chat, and Michelle Loosely, who will be speaking next. So I'm really happy now to introduce my colleague, Michelle Loosely, who's the Senior Manager for Climate Education at APHA's Center for Climate Health and Equity. She promotes climate and health awareness and advocacy to students from age 3 to 30. Michelle's commitment to diversity, inclusion, and equity has guided her work at several leading U.S. government agencies, including U.S. Agency for International Development. And she has worked in almost 20 countries. So she brings a lot of experience to this conversation. Our second speaker is Damilola Olugbemimo, is a climate champion working towards bridging the gap in climate and health interventions between low and high income countries. She herself comes from Nigeria and brings all that international experience while she's studying here in the US. And I had the privilege of meeting her and getting her engaged in this effort using the toolkit. And you will hear her story when she speaks after Michelle. She's very engaged with the American Public Health Association's activities, such as advising the editor-chief of the APHA journal. And she was awarded the 2023 Student Champion for Climate Justice by the Center for Climate Health and Equity at APHA. So with that, I will turn it over to Michelle, and once she completes her presentation, she will pass the mic on to Damilola. Thank you very much.
I'm sorry, I forgot to unmute before I shared my screen. So let me get us back to that.
While Michelle is getting ready, I'll just invite each of you, if you would like to introduce yourself, you could use the chat to do that. Some of you have done that, and please feel free. Go ahead, Michelle.
Thank you so much. Sorry for that moment. Welcome everyone today. We're excited to be here. As Layla laid out, this toolkit is a really important tool for us to share with the community, to encourage people to use it within their own communities, for educators to use it within their classrooms. But it was designed specifically for public health professionals to go into the schools and the communities that they work in. We know that people want to get climate information from health professionals, and so the toolkit is there for their resource, but it's also designed the educational background and has been tested with educational credentialing so that it will service those that use it. And I want to set this up so that you can hear Dami's presentation of how she's used it in the community by talking about why climate and health is a great fit and why it is a particular way in which you can work within your community, and it's almost a palatable way of encouraging people to talk about climate. We also know that climate, as the video described earlier, we know that climate is something that is distressing for students. And so we want to talk a little bit too about climate and mental health and why it's important to address that when you're out in the community talking about climate and education. So why climate and health? We know that many people are concerned about climate. One survey has shown that 72% of people report that they're very concerned about the climate, but they only believe that 52% of the population around them are as concerned about it. In fact, those that are very concerned about climate change feel that only 14% of people are as concerned as they are about climate. And so I think it's really important to recognize that this gap exists and that we should look to see how we can help people bridge that gap. We know that 86% of K through 12 teachers and 84% of parents of kids under the age of 18 believe that climate change should be taught in the school. But once again, people aren't really talking because we know that most students receive little to no climate education in their school. One survey of 1,500 middle and high school instructors, for example, found that teachers only dedicate about 1 to 2 hours to the subject across an entire academic year. People aren't talking because for various reasons. One, they think other people aren't interested, but also climate, especially here in the United States, is kind of a charged topic. But when we bring climate and health together, studies have shown that that actually is a message that works for people. Why does climate and health engage folks? Climate messages paired with health are palatable. These messages are tangible, practical, and people have experienced climate events. Climate drivers are events occur in our own backyard. People have more and more communities have experienced significant flooding, or of course last year, so many communities had their highest recorded heat temperatures of decades or of all time. Forest fire has affected our air quality. So people see these climate drivers, experience these climate drivers, and want to get answers. So we link these messages about what's occurring with health problems that occur along with that. Increased rates of asthma or earlier, or people having more incidents where they've had vector-borne illnesses such as ticks and mosquitoes, or people suffering from heat stroke. So people can connect the climate event with a health problem that they have. But then what we also link them to when we talk about climate and health education, we also talk about local mitigation and adaptation strategies, strategies that are practical that people can apply within their own homes and within their own families. Being more aware of this, making certain they wear protective clothing when they're out during tick season. Simple strategies that people feel that they are taking care of charge of their own health and that they are addressing the climate change within their own family. Of course, all of this links to personal advocacy and interest. People are aware of how this protects their family and feels like they can protect their family by participating and learning about these messages. Our research has shown that providing information about the health consequences of climate change can increase climate change issue engagement and support for mitigation policies. Advocacy messages about climate and health are more effective when they include information about risks, solution, and action. And so that's what our toolkit does. It really talks about climate change, what's occurring around them, what the students have experienced, talking to them about how that exposure leads to various health risks, and talking about how the health risks that have occurred within their own families or within people that they know. So that makes it very personable. And then we talk about the solutions. What steps can people take within their own families or their own health to mitigate this and to adapt their surroundings to confront those effects of climate change. So climate and health is actually a very positive messaging, and people can come out of those trainings feeling more positive than they were going in. And that's another important part about having the climate and health message put together, because it does bring hope. Whereas, as you heard from the students in the introductory video, people often feel despair around the issues of climate change. And that's why I also want to talk today about what we know about children, mental health, and climate. I want to reference a toolkit, a report that was issued by our friends at the American Psychological Association, Climate for Health, and Echo America. And I'll put that in the chat shortly. It's called Mental Health in Our Changing Climate, Children and Youth Report in 2020. It was just released last fall in 2023. It shows the effects of climate change on children's mental health, inequities that lead to some populations bearing greater impacts, and solutions to support the mental health of children and youth on the individual and community level. No matter what lesson plan you're putting in about climate, we suggest that you understand that this may raise certain issues for certain students and make them more on edge, perhaps, as they're talking to you. So it's important to have that in mind as you're putting together your climate lesson plans. We know that climate-related trauma isn't just physical, but it can also be mental. So people who are having acute exposure, like with floods or wildfires, that they will experience PTSD, anxiety, and depression, and often this increases violence within communities. Chronic exposure, such as droughts or land loss, causes complex trauma and often grief or loss of identity, and often promotes self-harm. But one of the traumas that we see very often is vicarious exposure, where just through climate awareness, children are becoming more and more anxious about their future. They fear and they dread what's coming. They have echo anxiety. And it's important to recognize that that's part and parcel of the culture of today. Children report 77% of the children in this study reported that the future is frightening to them, that 58% said humanity is doomed, 57% said my family's security is threatened. They say it's different for us young people. For us, the destruction of the planet is personal. Knowing that they're coming with that concern, I think we ought to shape our message and be concerned when we're putting together a lessons plan to make certain we give time and space for those discussions to be had. Remember, if we talk about it, it's mentionable, it's more manageable. Before you plan your own lesson plan, make sure you manage your own anxiety. You're taking action by providing a lesson or teaching about this, and help that encourage yourself to identify hope in areas. Be curious, accept the feelings that children are expressing, and avoid minimizing them. Monitor what types of media that they're looking at, and discuss with them how much exposure can be too much by just continually scrolling and looking for those types of stories. Remember that your goal in the workshop, of course, is to talk about climate, and you're not necessarily going to treat anxiety, but by once again discussing it, you're going to have children feeling a little relief from having those discussions. And then, of course, in the end, encourage collective action. We encourage you to have these lessons in order for students to talk one with another. We have found through people who've implemented the toolkit that these kind of discussions, especially held with other students, is eye-opening to students. Once again, like the earliest numbers that I gave you, they felt like they were alone talking about climate change, or that they were alone in their concerns about climate change. But they'll often find classmates who are out doing something in the community that they also want to participate in, or they'll find students who are also concerned in the same way they are, and they'll form their own groups. So those kind of results are the things that we've seen when people have implemented the toolkit. So once again, today, I encourage you to think about making your message be a message about climate and health. We've got a toolkit that Damilola is about to talk about that will help you put together a plan, put together a lesson, and also it's a sort of soup to nuts toolkit, in that it'll give you a guide on how to reach out to students, or how to reach out to the school, or some sort of class, or perhaps a community group, or perhaps a church group that you participate in, to give this class or give some sort of lesson to them. And we also encourage you, because I know that my examples have been from mostly American sources, since I do work for the American Public Health Association, but internationally, please go ahead and look at the toolkit and look at the resources that we have. Some of them do provide international maps that can give you guidance on how global climate change is occurring. And then also some of them will provide resources that are localized here in the States, but you might have similar resources in your own country, and that will give you perhaps a hint of what to look for. The link to the education guide is here on the slide, but of course we'll be putting it in the comments or in the chat. Now I'll turn it over to Damilola.
Hi, Michelle. Thank you so much for that. I really appreciate it, and you really set me up well for this. So, good afternoon, everybody, or good morning, everybody, from wherever you're hearing me from. I wanted to start with a little bit of my journey in climate and health education. So I started climate education right from Nigeria. I'm an international student here in the US. I'm studying for my master's in public health at the Western Illinois University. And when I started my public health program, I wanted to, focus more on the intersection of climate change and health. I also have a background in child development, so I've been concerned about child health since my university days. So during my search, I found some toolkits, and part of those toolkits were the toolkit for the American Public Health Association. And I would say that this toolkit is very easy to use. And so I decided to talk to some of my colleagues, and one of them is actually on this call, and I'm so glad to see him here. We were all from a low and middle income country, and we all came together to use the toolkit to teach at the local high school here in Macomb, Illinois. And one of the reasons we considered using the toolkit was because in our own public health curriculum, we have very little or no reference to climate change. We do take a course in environmental health, but we do not have a direct pathway or a separate certificate that will teach us in-depthly about the intersection of climate change and health. So most of my knowledge came from external organizations, especially from the APHA, from all the webinars, from the environmental health committee at the APHA. And secondly, it is very important for us to create awareness at the intersection of climate change and health in McDonough County here in Illinois. So there are three major things why this toolkit stands out for me. The first one is it's very easy to use. If you see the picture on the right, on my right-hand side here, you can see that this is the interface of the presentation that has been prepared in the toolkit. So it's all prepared for you. You could just put your name, put your date, and where you're using this toolkit. And another good thing is the fact that this toolkit is made for high school students makes it very easily adaptable to any setting. You don't necessarily have to use it in schools only. In fact, I would say that I also found it very useful in faith organizations or community organizations, as long as you have kids or you have even adults that are willing to learn about this. And it's very concise, it's straightforward. It's not like so many other toolkits that you would have to go through different kind of words to pick out the necessary information you want to talk about. And before you get to that point, you're tired already. So it's easy to use, it's straightforward. So this was our process while we're trying to reach out to the school and, let them know that we want to come talk to the kids about, the intersection of climate change and health, create awareness about climate change and health at the McDonough High School. So this email template here was also included in the toolkit. We just had to copy it and put in our names and our details and send it out to the principal. We didn't have to sit down. It wasn't very hard to do. So we reached out to the school principal and he then directed us to the health teacher, and we provided him with information of the day we were going to be available, the duration. We talked a little bit about the toolkit. And we also try to ask him questions concerning technical support, just to know what we are going to have access to. And then he gave us the feedback, letting us know that, they're really happy to have us, come talk about it. Even the teacher himself said he was going to be interested and, he was willing to learn as well. So we came up with an execution plan just to make everything go smoothly. We couldn't execute the whole toolkit in a day. We were supposed to teach for about 100 minutes, but we were not going to have 100 minutes in the school, so we decided to split it over 2 days. So we wanted to know the amount of resources that were going to be available for us to use in the school, and to know the things that we're going to use also. We were trying to make sure that it's not going to be too complicated. And we needed information of how many students were going to be there, and if the teacher was going to be actively involved in the lesson, because one of the very important things is to let the teacher continue the conversation in class. So wherever it is that you're using the toolkit, make sure that the leader or the person that is in charge of those kids, they are also actively involved, so they could continue the conversation after you're gone. So we sort of also brought in climate justice stories, the ones that are very common in Illinois, just so the students will be able to relate to it. And we are not just talking data and numbers. We don't want to wear them out with all of those. And another very good resource that was included in the toolkit was the CDC environmental tracking page by county. So it's a very simple, interactive website where you could just put your county, your what's this code, your zip code, and when you put it inside, it's going to let you know all how climate change is impacting people in that particular county. So we did the same for Illinois, and we came up with this infomercial that included how climate change is affecting people's health here in Illinois. So we had heat waves, floods, droughts, and air quality, and so many other health conditions that comes up with all of these environmental changes. So on the very first day, the teacher introduced us, and we sort of created like a baseline knowledge question just to know how the information that the students have initially about climate change. And this was actually not included in the toolkit, but this buttresses my point of saying that the toolkit can actually be made yours. So we wanted to know what the students knew before, just to see if they have any form of misconceptions about climate change before we started talking about all of this. So this was the baseline questions that we created. We wanted to know if they understood the intersection between climate change and health, if they believe that the government, has a responsibility to stop climate change. And over half of them actually did have a misconception about maybe climate change or the weather. Some of them were trying to chart how climate change directly affects human health. So we were able to know where to start from in our lesson. So for the very first day, we grouped them according to all of those major effects, just to foster personal communications between all of those students. And the second day, we walked them through this pathway. It was included in the toolkit. We helped them start with the changing temperature, flow rates, and air quality, just all of those effects that are affecting people mostly in Illinois. And we took them through this pathway and the health outcome. One of the things that I think you should all take note is the fact that depending on the age of the children you're teaching or even the location, you might want to look for languages that they would understand better. You don't have to make it very scientific for them. And I would say you should try and focus more on the health outcomes more, because that is what they will be able to relate with. So after we separated the students into groups and they all created, this partner, we use this post-it notes to sort of talk to them about it. We made them have each group presented someone to come and talk about what they talked in their group, just to, foster general conversations amongst the whole class. And after they did that, we talked to them about vulnerable populations to make them understand that climate change doesn't affect everybody the same way. It's affecting people in the low-income community more, and how it's an environmental justice issue, and how they need to talk about climate change from a health lens, because the health is the major equalizer to talk about climate action or even to take climate action. So the last thing we did was try to apply the baseline questions again. We wanted to make sure that we have made an impact in their knowledge. So when we administered the baseline questions again, so many of the students now had, they now understood the direct impact of climate change on health. They now understood the importance of advocacy and how they need to reach out to the government to do something about it. And the good thing is, after we left, so many of the students were now coming together to sort of start an environmental justice club. So we decided that during the Earth Day this year, we're going to go there to help them see how they can set up this club and sort of continue the conversation amongst themselves. And we also encourage them to reach out to the local community, their faith organizations, their sports clubs, and even amongst their family, because we believe that the family unit is a very, very important tool to talk about climate action from the local level to the global level. Thank you so much for listening to me. If you have any questions, please feel free to reach out to me, and I would love to continue this conversation after this presentation. Thank you so much.
Thank you very much. That was really nice, Damilola, and as well as Michelle and Layla. We're very fortunate to have the collective expertise of the American Public Health Association to put together this great toolkit. And so we're going to turn to questions and comments in a moment. I will just say, I'll invite each of you, if you want to, either unmute or raise a hand, or if you want to put comments into the chat or questions. And then also, if you haven't already done so and would like to, please put your own name and institutional affiliation and email, if you want, into the chat so that others can follow up with you if they would like. So I guess, well, let's see, are there any, and I guess the one other thing I just want to say to tie the two pieces of the webinar together again is that using the toolkit and taking advantage of Worldwide Climate and Justice Education Week to begin April, that it really is, I think, a pretty relatively easy and straightforward way for you to um, go into the schools in your community and educate the students, because the students want to be learning about these things. They're interested in their health. They're as pretty shocking figures that Michelle just are quite alarmed about their future in the climate emergency world. And so here's a chance for each of you to come in and talk, not just that one time, but many times. Go ahead, Michelle.
Yeah, I think that that's one of those things that is really important to remember is that students are really fascinated by this information. Many of them have been hearing about climate change since they were very, very little. One of the other things I do here at APHA is I recommend children's books on climate change. So check out our website to see that. But they've learned about this from their childhood, but they haven't made the connection. And many of us don't teach the connection between climate and health. And so I gave the example earlier that the EPA used this for some of their summer student institutes. And they found that having this additional information about health was really innovative to the students, and they felt like they were learning something that they'd never really heard before. So I think if you want something that'll be new for your students, this is a great way to go.
Awesome. And then, yeah, and we will be sharing the recording and the presentations and the links with everybody who has um, registered for this meeting. So if you miss something, you'll have another chance. So are there any questions or comments for myself or for any of the presenters?
I just want to add, I'm my name is Shweta Arya. I'm also with the Climate Center team at APHA. This is kind of the first time I'm looking at the details of this toolkit, and I plan to use it in my community. I used to give climate presentations in my local high schools, but I feel like when you add this layer of connecting climate and health, it just makes it so much more powerful, because not everybody wants to listen to climate change, that's the fact. But when you really connect it to health, it becomes so much more personable. So I feel it just gives you that outlet to engage students on, and especially even the faculty too, right? Like they're very open for this kind of discussion. It doesn't come more like organizing, which is not everybody's open to, but this is something personal. We're talking about health and well-being. So I feel this is a great tool to engage young people, and we need all kind of engagement at this time we are living in. So I hope a lot of you will use it and share it with others.
Thank you very much, Shweta. Damilola, what would you like to add to your fabulous presentation?
Thank you so much for that. I was just going to build on what she said, is that usually most climate actions are usually health actions. And one thing that most people care about is their health. So if there is any common ground that we all have to take climate action, is our health. Health is what concerns everybody. Either you're rich, poor, old, educated, or uneducated, any age that you are. So when we talk about how climate actions can actually help people's health too, I think it will make them more receptive to want to, work towards it. That's all I wanted to add. Thank you.
Okay. How about the rest of you? Do you want to maybe share your experiences or your thoughts in terms of working as community health professionals and educators? Does this resonate with you? Are you getting in your community? Are you seeing this concern about the connections between climate and health? Do you think that these tools will be able to be helpful to you? Yeah, and if you're not able to, um, to unmute, you could always put a question or comment into the chat.
Well, while we're waiting, David, I want to acknowledge the passing of a wonderful man who was a climate champion. Ross Galspan died yesterday. I don't know if any of you know of Ross's work. He was a Pulitzer Prize winning journalist for the Boston Globe. And in the 1990s, he wrote two great books, The Heat Is On, and I can't remember the second one, but basically exposing the oil industry disinformation campaign. And he was a tireless climate advocate. He traveled all over the world, colleges and universities, really trying to kind of raise the alarm in the 1990s and the early 2000s about the challenges that we face. So he was an inspiring man. I think at this time we need this kind of inspiration and to become the kind of educators and speakers of the truth that Ross was. And so I want to just thank you all for being, walking in his footsteps and carrying on the good work that he was so powerful with during his lifetime.
Yeah, thank you. Yeah, the Heat Is On was, I think, it really kind of hit people right in the face at that time, and paved the way for a lot of other things. Yeah, so people are commenting on liking the intersection between climate and health. And I think, we also, I mean, you talked about it, but maybe we need to talk even more just in terms of why we're talking about climate and justice with, climate change. And certainly, I mean, that's the name of the center that you are helping to lead, Michelle, at APHA. But climate change really is the ultimate issue of injustice. If you think of any scale, whether it's within a community or nationally or across the globe, that those who contribute least to the climate crisis are those who are feeling the impacts most greatly. And that's similar to so many other health impacts of compromised health resulting from bad air and bad water and toxic substance. And so it's really important, I think, that we all help people to bring about that connection, because not everybody, people are sort of getting the climate thing. They know about their own health, but then we're still, we get questions, well, why do you say climate and justice? So I think that's incumbent on us all. I don't know, Michelle, do you want to comment on that at all from perspective of your work?
Absolutely. I think it's imperative to the work that we do. I think the toolkit definitely has a section on that. And I think Damilola had raised that in her presentation, that I think she raised it with the students that she was working with who were really unaware of the disparities that occur within the climate realm with various communities. And so I think it really is important for us, once again, to raise awareness of it and realize that it's not an equal, the climate change is not affecting all of us equally. And some people are completely avoiding it. I think if we talk about extreme heat measures, you've got so many homes that are that have air conditioning that don't seem to worry about it at all. But we've got so many communities that don't have the resources to be able to keep their homes at a really nice climate throughout those extreme heat events. And so I think the more we talk about it, the more we can bring justice across the world. I think by looking at that, I think the other thing is the mental health resource that I pointed out as well also talks about the disparities and how climate does not equally affect everyone. And so I think it's important, as the more we read about it, also we can raise awareness around that.
Yeah, if I can just thank you, Michelle.
Please.
Basically, you covered everything, but just wanna, again, I mentioned this in my introduction. When we started working on adapting the NIEHS curriculum for public health professionals, one of the things that we realized was as the society is evolving, and awareness is increasing, not that those of us who are in the front haven't been committed to environmental justice going back decades, but at this time, which was about 3-4 years ago when we were working on the toolkit, we realized that there was a great opportunity to bring in the environmental justice front and center. It was there, but we wanted to expand it and shed more light to it. So I'm really proud to say that we worked with, and it's all in the toolkit you'll see in the introduction, that we recognize. We work with 2 youth leaders who environmental justice youth leaders at the time they were in high school. And obviously since this is a tool for high school students, and it made a lot of sense to get them involved in this. And so they had formed an organization on environmental justice through leaders in their communities, and they helped us develop the what we call the environmental justice extension piece. So I wanted to shed the light on that as well. Not that ever this is enough. We need to continue working. And again, as Michelle said, I'm one of the contributors to the mental health report. We made sure that was part of the mental health report as well. So, but again, we need all of you in the field to make sure that on the ground, this is a key piece of the work. I mean, climate injustice, they go hand in hand, right? We need to do a better job to really protect those communities first. And once they benefit, the rest of the world benefits. And I'm putting children in that. So yeah, and please give us feedback from your communities, how we can help you, how you can help us. We can only achieve these small results that are big for the people affected, of course, if we work together.
Well, thank you, Layla, Michelle, and Damilolo, and thank each of you. There is, even though it's mostly the 4 of us who are talking here, there is an active conversation in the chat about people, wanting to learn more and to engage, and thank you for that. So I'll just say just a couple concluding things that for those of you who are new in your role and are looking for more resources, Carrie Ann has been putting various content that we have in the chat. We will share all of that with you in a follow-up email. If you feel like you're good on the climate stuff, or I'm sorry, good on the health, but not maybe as strong on the climate, we have a speakers bureau that we can help you to find somebody, certainly virtually, and maybe even for an in-person activity. If any of you would like to register for the speakers bureau, we'll provide that information to you as well. We will be having more of these webinars every Wednesday at the same time, either noon Eastern or also at 9 a.m. Eastern. Next week, Valentine's Day, we'll be hearing about an Earth Month calendar developed by our partners at Earth Day Organization and other organizations, where there is a theme for each day of Earth Month, and curricular resources at different levels available for that. On the 21st, actually, this will be at 11 Eastern, just one webinar, because we have one presenter from England and one from Louisiana. So we're sort of splitting the difference on the time, but that's going to be about teaching about climate in a politically challenging environment. and many of us are facing that. And then on the 28th, because we all need hope in this situation, that we're working with a film production company that has a series called Wild Hope. And these are short films about people acting to save biodiversity and to respond to climate change. And those will all be available free to anybody who wants to use them during Earth Month, along with curricular resources. So we'll be sending you information about all of these opportunities in our follow-up. And again, we just want to thank each of you for joining us today, and especially to thank Michelle and Shweta for initiating this partnership and bring it forward. Layla for her ongoing leadership in this, and Damilola for showing us the real connections and bringing in your passion to this as well. So thank you, everybody, and we're here to work with you.
Thanks so much. We'll talk to you soon.
Thank you.
Okay, Kieran, you can stop the recording now.